What's up, everybody? Happy Monday. Let me get my technology rolling here. Welcome to another episode of Learn with Flo. I'm super excited to join you guys. Like I said, new week, new month, which means we're going to be continuing to kind of dive into some of the topics that we've been setting the stage for over the last few months. So today is going to be no different. If you are new here and new to my Learn with Flo, welcome. You have stepped into a scene where my passion and my mission is to really create this whole seismic shift in the healthcare system as a whole, teach you what like root cause medicine truly looks like and how to really embody this self-healing persona that I feel like is inside all of us, right? And so as part of this mission, I get this beautiful opportunity to be able to guide people that are interested in really learning how to connect the dots to treat the root cause of a lot of their symptoms and really learn how our body is really like one interconnected whole and how conventional medicine kind of splits us off into all these different subspecialties, right? And it kind of leaves us spinning our wheels, especially when we have a little bit more like complex cases that sometimes even conventional medicine doesn't really always have an answer for, right? And so especially when I think of like complex cases, a lot of times I end up talking to individuals that have chronic gut issues, right? That can be not the only one that kind of gets dismissed by conventional medicine, but it's definitely one of the more common or popular themes that I tend to see in individuals that aren't quite getting the relief that they need from, you know, conventional medicine and honestly, even sometimes functional medicine as well too, which we'll talk about today. So if you were with us last week, we talked about this concept of histamine and histamine overload, histamine intolerance, which can definitely be another one of those situations where we get like all of these like seemingly unrelated symptoms, right, that are kind of popping up all over the body and not really knowing how they all relate together, right? So like histamine intolerance could look like the period flu and PMS and PMDD. It could look like migraines and flushing of the skin. It could look like itching and rashes and hives or brain fog and dizziness or nausea, abdominal cramping, fatigue, blood pressure changes, right? And so it's like in a conventional medicine sense, going back to that splash pad analogy that I gave you guys last week, like I got so much great feedback. They're like, that splash pad analogy is legit. Like, I totally get it. I'm like, yeah, it just like, it's the first image that comes to my mind when we think about like every symptom is kind of like one of those little geysers, you know, at those splash pad parks, right? And it's like, I don't know which one the water is going to come through. So I'm like running around like a crazy person, like trying to stomp out the different holes. That's kind of the standard medical model that we live in, right? So it's like in something like a histamine issue, they might give you like, oh, here's some antihistamines for the rashes or the allergies, or here's a antibiotic for your chronic sinus infections, or here's birth control for your period flu, right? And it's like, what's the underlying source of the water though? Can't we just like shut off the water? Right? That's where my question comes from, is like, what is the source? What's like the root of the root of the root of a lot of these things? And unfortunately, I think a lot of times that does represent a lot of people's experience with like conventional and or like functional medicine, just like spot treating symptoms. So aside from like misdiagnosed histamine intolerance, which I feel like I've had lots of different conversations about with individuals, another very common diagnosis that I tend to see that is kind of misrepresented in the medical space is our perfect one called IBS, right? Irritable bowel syndrome. And most individuals that have any sort of GI issues, especially if there hasn't been like a known cause or a known source of the GI issues, they tend to get slapped with an IBS label and sent on their way, usually with a prescription for something like Linzess or a stool softener. And they're like, yep, this is kind of your life sentence, right? It's like, that's what it's been known to us to be seen as, right? It's like, oh, you have IBS, here you go. Like lifelong label that you'll wear, and the best that you can do or hope for is just to like manage your symptoms, right? And so if this has kind of been your typical story, I want to present to you guys a different idea. And I think that this statistic might actually shock you when you hear this. I know it did for me when I was learning about this for the first time, but it's actually estimated that 60 to it's a huge number, 60 to 80% of individuals that have been diagnosed with IBS actually have something called SIBO, right? Small intestinal bacterial overgrowth, right, is what that stands for. And why do I make that differentiation? I make that differentiation because IBS is kind of treated as something that, like I said, is a lifelong label. Here you go, you'll wear this forever. But if in fact a lot of the symptoms and etiology of that IBS diagnosis are coming from a microbiome imbalance, that is very treatable. Very treatable, very reversible, right? Not something that I can see on like an endoscopy or a colonoscopy though. So you'll go to like kind of your conventional providers with a lot of these GI issues. They might run some of your classic GI testing, but you can't see the microbiome on a scope, right? They're looking for like structural damage, right? Do you have polyps? Do you have cancer? Do you have diverticulitis? Like, is there something visible to my eye that I can see is a malfunction in the digestive system that could be causing symptoms, right? Thank bless that 9 times out of 10, all of those scans come back perfectly clear, or you're told that you have a low level inflammation, right, in the gut, and you tend to get slapped, like I said, with that IBS label and probably sent on your way with some sort of prescription, right? So that is a huge cohort of individuals that are getting left to feel like this is like a lifelong diagnosis and a lifelong label, and that's just simply not true. Right? So let me be the first, if I am the first to let you in on the little secret, let today be the day that there's like a new perspective that this IBS like kind of is BS, right? I say that with the love and compassion of wanting you to hear from a different perspective, right? It doesn't mean that IBS symptoms are not real. Oh my gosh, IBS symptoms are so real. They absolutely impact somebody's quality of life and really, take them out of their normal day-to-day activities. That is absolutely real. So I'm not taking anything away from the actual symptoms themselves. I'm telling people that the label and the treatment options that you've been given for that label are not necessarily true, right? So the symptoms are very real and very true, but necessarily like the label that you've been given or the treatment options that you've been told are the only things that exist. Not true, right? So if we kind of come to the table and you're like, oh wow, so there's some like leading researchers out there that are showing and proving the fact that 60 to 80% of IBS cases are actually gone untreated or misdiagnosed as SIBO, let's double click on this. Like, what the heck is SIBO? How would I know that that might be me, right? So SIBO, SIBO, stands for small intestinal bacterial overgrowth, right? So if like, as the name implies, it's commonly described as an overgrowth of bacteria in the small intestine, right? Fun fact, we shouldn't have a ton of bacteria in the small intestine. Most of our gut microbiome lives in the large intestine. And so we start to kind of look at it and it's like, so if we really want to describe this more accurately, this is where this differentiation is going to be important, and you guys will see this in a second. But it's really not an overgrowth of bacteria as much as it is bacteria in the wrong spot. Yes, exactly. Or what we call in functional medicine a translocation of bacteria, right? So it's like, oh, so it is bacteria that's not supposed to be in the small intestine, and now it is in the small intestine, and it has an opportunity to like grow and thrive and colonate in the small intestine. So then it causes issues, right? Yes, it does. Because when there's bacteria in the small intestine and it's not supposed to be there, then we eat foods, and the food then, instead of being absorbed in the small intestine like it's supposed to, it starts to ferment in the small intestine, right? Which can cause then gas, bloating, distension, feelings of fullness all the time, right? And with that translocation of bacteria, as it progresses and gets farther and farther along, those bacteria and that fermentation process also releases toxins into the system and can cause leaky gut. It can cause immune system dysregulation and all sorts of like bigger systemic inflammatory responses, right? So I say that because like the symptoms are very real. But I think in conventional medicine, obviously this gets misdiagnosed as IBS and you're kind of sent on your way. But even in functional medicine, we might identify that SIBO does exist in a lot of cases, but the differentiation between defining it as an overgrowth of bacteria versus a translocation in bacteria is the difference maker right there, right? Because a lot of functional medicine will come in and they're like, yes, we found SIBO, this is great, boom. And they're gonna come in with like all of these antimicrobials, like some flamethrower to the system, right? And it's like, whoa. We have to ask the question of like, we can't just like come in and start like flamethrower the system with like antimicrobials. We have to ask like, why is there SIBO to begin with? Like, how did the translocation of that bacteria end up in the small intestine when it should be kind of housed in the large intestine, right? So that's kind of the differentiating factor between like my approach to a SIBO and how I was mentored and taught around SIBO versus like your traditional functional medicine that's just going to come in with antimicrobials, which is no different than flamethrowering the system with like antibiotics, right? So I say that because when we're kind of thinking about like 60 to 80% of these IBS diagnoses are being mislabeled as what's actually a SIBO situation, then individuals are getting into these functional practitioners that are like, I think I have SIBO, and they're getting mistreated because we're not addressing why the SIBO exists in the first place. Why did that translocation of bacteria exist, right? So that'll be kind of important as we talk about like the treatment strategies, or kind of like what I call like the lowdown method. Like when we're going to really get into the SIBO, like what do I think about with patients and clients that I'm working through this process with, right? So some classic symptoms of SIBO also sound like classic symptoms of IBS, right? Wonder why, right? Because sometimes they're misdiagnosed from each other. So abdominal pain, gas and flatulence, a lot of bloating, abdominal distension, diarrhea or constipation, which is why we tend to get someone diagnosed with like IBS-D, like IBS with diarrhea, or IBS-C, IBS with constipation, right? So it can take on both different looks. Fun fact, that's because there's multiple different types of bacteria involved here. And so they can kind of present as like diarrhea symptoms or constipation patterns. Heartburn and reflux, nausea, fatty stools, feelings of fullness, or like food sits like a rock in my gut is what I hear quite a bit. Or individuals that are dealing with like increasing numbers of food sensitivities, right? So hearing any of those types of things, I immediately start wondering like, was this IBS like mistreated or mislabeled as something that is actually 100% treatable and 100% reversible in kind of like a SIBO picture, right? Also, like I said, I know that there's a lot of times like leaky gut can be caused by translocated bacteria in the small intestine. So I also look for symptoms like fatigue, brain fog, headaches, changes in mood, skin issues, joint pain, right? All of those things are kind of symptoms of a leaky gut. But then we ask like, well, how did someone get a leaky gut? It's like, oh, well, they probably got a leaky gut because they've had longstanding SIBO that's been undiagnosed or misdiagnosed, right? Additionally, SIBO can also just like disrupt like healthy digestion and absorption in general. So a lot of times other symptoms can also include severe nutrient deficiencies like B12, vitamin D, iron deficiencies. They're most commonly associated with like, is there like a malabsorption issue going on because of that translocated bacteria in the small intestine? So that's where I say like conventional medicine has a pretty limited scope in its ability to even like diagnose or see SIBO, because they're using things that are more like endoscopies, colonoscopies. They're looking for structural issues in the gut, not so much being able to actually culture or look at microscopic things like bacteria and the microbiome, right? Also, let's be real, even though conventional medicine doesn't necessarily identify this very well, let's be real, functional medicine oftentimes misses the mark here too. And it just like, it pains me so much and saddens me so much when I've seen individuals that have kind of been burned by multiple functional practitioners. And so then by the time they get to me, I'm like, no, like, she's like, oh, I've been told I've had SIBO before. I was like, I know, but your treatment of it was like all wrong. And so it just keeps coming back because nobody addressed the root cause of it. Everybody just wanted to flamethrower your gut with antibiotics and antimicrobials or like a low FODMAP diet and acted like you needed to stay on that forever. It's like, that is not the solution here, folks. Like that's the opposite. That's what keeps people sick, and that's what keeps people struggling, because the SIBO will reoccur. Absolutely. If that translocation of bacteria happened once, it will absolutely happen again if we aren't understanding why this translocation happened in the first place and we're just seeing it or treating it as an overgrowth. It'll just keep coming back, right? So that's where we have to be different. So when I suspect SIBO, right, what do I kind of look at as a practitioner, and helping you guys kind of see a little bit of an insider view into what I call the lowdown method for SIBO, right? What are some things that I look at? This is a high level overview, but it starts to get your guys' wheels turning into like, have I went down that path? Do I feel like these align to a lot of my symptoms? Is this how I was treated? Or like, I haven't even ever thought about any of these types of patterns before, right? And in which case, hopefully this is, like I said, my little foot in the door to get you thinking a little bit differently about how to treat IBS, or how to look for, was the IBS in fact actually missed as a SIBO diagnosis, right? So don't worry, we can and absolutely will use therapeutic strategies while we're digging for the root cause here. I want people to feel better as soon as possible, but some of this does take some time to kind of peel the layers apart as well too. So step number one of the lowdown method for understanding, like, what am I dealing with this IBS picture? Is there a SIBO influence involved here? Number one is testing, right? Is it absolutely necessary? No. Is it incredibly helpful and like totally shrinks the timeline for treatment and reversal of symptoms? Yes, absolutely it does. So when I'm looking at testing, I personally utilize like functional stool testing, specifically like a GI map test is one that I use frequently so that we can assess down to the level of like the microbiome. Like I want to look at microscopic level here, not just what we see structurally on like a colonoscopy or an endoscopy. So within these tests, you have to obviously have a trained practitioner working with you to identify what the heck I'm looking at with a lot of these tests, right? But there's different patterns that I'm looking at that could signify some of these kind of small intestinal bacterial translocation patterns, right? So I'm looking at like overgrown or high bacterial phyla in a lot of these. There's a couple markers called your bacteroides, your firmicutes. I know I'm going to be speaking a different language, but that's, like I said, what your trained practitioner is designed to help you with, right? So some overgrowth in some of those bacterial phyla usually indicate that there may be some SIBO influence because there's some undigested food happening, some fermentation of food happening there. I also see like low digestive function, low digestive enzymes with like low stomach acid, low elastase markers. I also might see some of these overgrown bacteria like high methanogens, high desulfovibrio. Like there's certain bacteria in the gut that actually cause IBS-D or IBS-C type symptoms, right? So we're actually looking for, at the bacterial level, what's present, what's overgrown, what's missing, what's depleted. There's kind of a particular picture that looks like SIBO to a trained practitioner, right? So once you spot these patterns though, I do not rush in and like, ooh, we found SIBO, this is great. I'm going to just come in with all of these antimicrobials and just wipe out all of that bacteria, right? And it's like, why do I not do that? Because SIBO is not a root cause, right? It's like here, I'm sitting here telling you like, oh, this is what I'm looking for to help reaffirm like a reversible IBS diagnosis, but I'm telling you like the translocation of bacteria happened for a reason, right? So if I just come in and just like kill off the bacteria that's in the small intestine, but I never answered the question of like, how did it get there in the first place? Then we're just going to be in this same regrow, reflare cycle about every 3 months. Right? Which doesn't do anybody any good. Maybe it's a great lucrative business model for me to just tell people, oh yeah, we're going to have to keep coming back every 3 months. I'm not doing them any good because they're just like band-aiding the solution or band-aiding the symptoms and not really getting to an absolute solution, right? So SIBO is not a root cause. If SIBO's occurred, it will keep recurring if we don't treat it as a translocation of bacteria and we just treat it as an overgrowth, right? Which then gets us into step 2. After testing step 1, step 2 is looking at why, right? It's like one of the first reasons, like why would bacteria start to colonate in the small intestine? First place I'm going to start to look is a top-down approach to digestion, right? So things like low stomach acid. Number 1, first line of defense of our immune system. Your stomach should be acidic. It helps kill things off. It helps neutralize bacteria so that bacteria doesn't leave the stomach and end up colonizing in the small intestine. It should kind of be eradicated in the stomach within the acidity of the stomach, but as we've discussed before, that first line of defense of our immune system, low stomach acid, it's kind of one of those pictures that a lot of Americans are dealing with low stomach acid and they don't necessarily know it, which is why this brings me to some really key conversations with my clients around things like, oh, my food hygiene habits, like actually making mealtime sacred and like chewing my food really well to the consistency of applesauce, not rushing through my meals, holding those mealtime sacred, eating adequate protein, huge one, right? If we're not eating adequate protein, then we're probably not creating enough stomach acid. If we've had chronic use of proton pump inhibitors or anti-acid medication, yeah, absolutely. Your stomach acid sucks. It's obliterated, right? And we also then need to talk about looking at your adrenal function and your cortisol levels because nothing kills your stomach acid faster than stress, right? So we have to look at the whole body as a whole, right? It's like, okay, I could come in and take care of this translocated bacteria, but I want to set you up for success and make sure that I'm keeping it from coming back again, right? That's where that stomach acid picture then comes in. So we can say step 1 being testing, step 2 being supporting stomach acid, step 3 is kind of coming at it from a bottom up approach because as kind of gross as it sounds, another common cause of SIBO is chronic constipation, right? You think about how our body works, things should move one direction, right? And if we get ourselves backed up, literal fecal matter can push bacteria into the small intestine because the large intestine is kind of full and impacted with fecal matter. Right? It is what it is. That's how the tube works, right? So that's another big one that we want to address by nourishing the gut-brain axis, right? A lot of times individuals with that SIBO picture, they don't have good gut motility. They have lack of what we call a healthy migrating motor complex, or your MMC. Right? So that migrating motor complex is what actually pushes food particles and matter through the entirety of the digestive system. And we can kind of get a sluggish or faulty migrating motor complex pattern. And that can really stall some of that movement of food through, movement of fecal matter through. And now all of a sudden we're getting translocated bacteria from the bottom up as well too. So we definitely want to support some of those migrating motor patterns to keep things moving in the right direction there. So a big treatment strategy of SIBO is actually recreating a healthy and robust migrating motor pattern response. And we do that by thinking about nervous system regulation, holding space for rest, making sure that we're incorporating vagal nerve exercises for some people. Lymphatic exercises are very responsive for other people. We also need to be addressing disordered eating habits like binging and purging things, right? It's like, oh, so that had stuff moving the opposite direction. I'm like, yep. So if you've had a history of that in the past, we absolutely need to think about disordered eating habits. We need to think about anxiety. Anxiety can absolutely stall the migrating motor complex, as well as evaluating thyroid levels and thyroid function, because sometimes undiagnosed hypothyroidism as well too can slow some of that digestive motility moving through the system. Therefore we get chronic constipation, therefore we get bacterial overgrowth in the small intestine, and now all of a sudden we have IBS. I'm like, do we have IBS, or Do we have SIBO as a result of a poor or faulty migrating motor complex pattern? Like that's where my brain is going with all of that, right? So step one being testing, step two being starting to look at like the root causes of some of these SIBO conditions like stomach acid support. Number three, really nourishing that gut-brain axis. Then step four, the potential of bringing in some antimicrobial agents or like some prokinetic agents? Hell yes, it is, right? It's like, I'm not going to withhold some of those things. They can be very therapeutic, but they're not the end all be all, nor should they be step one. And that's what really irks me, I think, about like this field of gut health in even like the functional medicine model is I will tell you right now that there are 15 different practitioners that could look at your stool test and give you 15 different directions because they are looking at this as an overgrowth and they're going to come in hot and heavy with antimicrobials because it's super sexy, right? But they're not necessarily doing you a service because they're not addressing why this pattern exists in the first place, right? That's what I'm extensively passionate about. And I recognize that, like I said, not everybody is up for that task, but individuals that are up for that task, they see the lifelong success. They see the lifelong non-reoccurrence or flare-up of symptoms again, because they've truly addressed it from the root cause, right? Which is the passion and the mission behind the healthcare model that I'm creating in the first place, right? So when we start thinking about, like I said, this IBS diagnosis, right? That's why I titled this talk, Your IBS May Be BS, right? And that's not to discount the symptoms that you're experiencing. Abso-freaking-lutely, I get it. That is a really, really influential quality of life killer there, right? But what we really want to come to the table and understand that 60 to 80% of these IBS labels are getting slapped on individuals when it's really actually something that's very treatable, very reversible through maybe looking at it as a SIBO lens or a translocation of bacteria in the wrong parts of our gut, right? So in that sense, that's what I work with individuals within all of my one-on-one coaching is the ability to snag some functional testing, to walk through a lot of these root cause approaches and to not just look at treating the symptoms that you have now, but also encouraging you to look at how we developed these in the first place, because that's going to be really the true medicine to make sure that this doesn't just pop up again and you're in these vicious cycles, right? So my style, the lowdown method of treating SIBO and IBS is going to be very different than maybe somebody else, but hopefully this was a good sneak peek behind the scenes of starting to get into my brain and how I work with clients in the same scenario. So if this sounds like you, or it sounds like somebody that you know and love, send them this Learn with Lo episode. If you're curious about learning more about an opportunity to work together, you can click the link in my bio. There's opportunities to check out any of my courses as well as apply to work together one-on-one as well. So we'll catch you guys next week for more gut love and conversations. If you like this, leave a comment, let me know what you think. And if there's any other, like I said, hot topics that you're curious about, and I'm happy to riff on them. So have a wonderful Monday and we'll see you guys soon.